Good afternoon and welcome to the Wavy Digital Desk. I'm your host, Sarah Good. Today we're going to be talking about an emergency department that's different. It's the Psychiatric Emergency Department at Riverside that's been open since November 1st. They opened their doors to fill a need in the community of mental health space that is different from your traditional emergency department. Now I want to bring on hospital president Stacy Johnson to talk to us about how it's been since November 1st with their doors open and what it really does so the people understand the resource available in the community, and we're going to bring her on now. Stacy, thanks so much for joining us this afternoon.
Thanks for having me.
Absolutely. Well, this opened up just a few months ago. Can you just tell me, off the bat, how has it been since November 1st?
Sure. So things have been going pretty well. We are lucky to have an amazing care team here to respond to the needs of our community. It's been busy, certainly, a little bit busier than I think we initially anticipated, which just speaks to the need in our community. But over the last 8 or so months, we've been able to treat over 3,100 patients in this space. And our goal is always to provide the least restrictive treatment options available. So we're able to get folks to outpatient services and connection with community providers and or an inpatient hospitalization if needed. So overall, things have been going well.
And correct me if I'm wrong, you said 31,000? 3,100. I mean, Still so many, and just shows, I guess, that people needed this service and that people also recognized this service was now available.
Correct. So it has been excellent. We've had folks coming to our facility seeking urgent treatment for a long time, which was one of the premises and really driving this and looking at opening a service like this. But it absolutely highlights the need, and we're excited to get the word out and let folks know that there's a place to come if they are in crisis.
And I want to talk about how you all connect people to resources and connect people with services, but I guess to back up first, can you tell us a little bit about this emergency department? It is part of that mental health center, but just tell us a little background about what this actually is.
Sure. So our psychiatric emergency department is the first of its kind in Virginia. So we're excited to be able to offer this. And really, it's a place for individuals to come that have an urgent mental health or recovery need. And that can be anything from a true psychiatric disorder to really just overwhelming thoughts of self-harm or harming others. And it's a place where they can go, and they have therapists, our amazing provider team as well, as nurses and psych techs to really help and support folks through that crisis. So as you can see on the screen, those are just some pictures of our unit, and everyone comes in and they get a medical screening exam, a crisis evaluation, see what's going on, and really see how we can help. The environment really, the intent of this is to calm and de-escalate our patients. A typical emergency department, I think the vast majority of folks have been to one before, they're pretty stimulating. There's a lot of noise, a lot of bright lights, a lot of folks running from one direction to another. And our goal with the environment was really to create the calm. And you can see right now one of our outdoor spaces. I'm a firm believer that fresh air can heal a lot of things, and a little bit of sunlight can certainly help. And that is not standard in psychiatric facilities, but to have a space where folks can step outside, I think really goes a long way. And generally speaking, our environment has sensory de-escalation rooms, just calming, soothing colors, and a place where folks can interact with team members to kind of step away from the crisis.
And this is available to both adolescents and adults.
Yes, so our service actually in the emergency department can treat anyone aged 5 and up. So we do have dedicated treatment areas for pediatrics, which would be 5 until the 18th birthday, and then on our adult side, 18 until whenever, from that perspective. But one of the things I think we're seeing nationally in terms of mental health treatment is there's a need at a younger and younger age. So really to be able to meet this need in a dedicated area was really important as we were developing this model.
And another really unique aspect is that also in the emergency department, that is that adolescents sort of have their own space.
Correct. So our facility is our emergency department. It's about 16,000 square feet. So it's a fairly big space. Everything, if you're coming in the front door, everything on the right side is for pediatrics and everything on the left side is for adults. So really to be able to interact with individuals within the same age range can also go a long way in terms of starting that healing process.
And talk to me about it's for mental health, but then also substance use disorders, that's included. Can you talk about the importance of that too?
Yeah, certainly. Again, nationally, I think what we've seen is, the increase in overdoses, increased need for general substance abuse treatment, higher rates of alcoholism and things like that. And we really wanted a space for our community to be able to go to start their recovery journey. So they're able to come here. We engage them after the assessment with what might be the most appropriate level of care. Some folks are able to engage quickly into an outpatient treatment program. Other folks might need a detox or a residential treatment program, but that's where our ED team comes in. So our providers and our therapists will do an assessment and make a recommendation and then connect folks with that, whatever's most appropriate for that individual.
And, let's talk about this is Virginia's first standalone psychiatric emergency department. What did that mean to you in developing this and now seeing it in motion and seeing the need that really it's filled there?
Yeah, so in terms of development, to be honest, when we first started looking at this need, we weren't certain if this was the right path to take. So we looked at a number of different models. We looked at urgent care models or, really enhancing what was in our medical ED. And what we landed on eventually was this psychiatric ED model for getting folks to the right place, really having folks have a treatment home. And on our campus, we do have inpatient services. We have partial hospitalization, that day treatment model, IOP, which is a step down, in general outpatient. We really wanted to create a place where folks could come for all of their needs related to recovery or mental health. Now, having be the first of its kind, certainly that doesn't come without challenges. But I think that we're in a state right now, as a community, as a Commonwealth, that folks are really willing to pitch in and help out and understand where does the licensing need to come from? How can we make this feasible so that our community can get the needs that they have met. So we've been really fortunate to have a lot of community support within that, but it's amazing to see it open. It's amazing to be able to talk to parents of their, children who are just not sure what to do, and to have a place where they can come that is destigmatizing, that understands the uniqueness of the individual diagnoses or what might be happening, to really kind of wrap our arms around folks and help them be successful.
And we've heard those stories where people go to the emergency room for those mental health services, maybe even 6 or more times, trying to figure out the method, trying to connect with someone. But it's a hard process for parents who don't know how to navigate, and then maybe an adult who doesn't have that support system or doesn't really know where to go. And that second piece that you mentioned earlier of connecting people to services, I feel like is such a huge continuation of what they need. Can you talk about that piece of it? Because you don't just take them in and then send them back out. You actually connect them.
Sure, absolutely. And I think that is a big asset that we have here. So when we opened our emergency department, we really took a look at what the needs were. We ramped up what we call our emergency department therapists. So they do everything from an assessment to an individual intervention to the case management aspect of that. So really understanding the unique needs of each individual or their family and making those referrals to to whatever appropriate level of care. I think another benefit of that is they're able to really help the patient, their families, their loved ones, their legal guardians, whoever it might be, understand what is available in those different levels of care. It's not unusual, just like in medical treatment, for a provider to make a recommendation and the patient says, oh, no, I'm not really interested in that. A medical doctor might recommend physical therapy and the patients say, oh, I can't make a 3-time-a-week commitment. That's very similar to what we experience here, but we're able to offer some additional support to say, hey, here's the benefit. It looks like you've accessed crisis services this number of times. What are we going to change and how are we going to do something different? And, really at point of arrivals, developing that individualized treatment plan with the outcomes that we hope to achieve with the patient and have them be part of that process. And, sometimes it takes a little bit of therapeutic intervention and some motivational interviewing to help folks kind of accept the need for different levels of care. But it's certainly been advantageous. And, I can't thank the amazing team enough, everyone, nurses, therapists, providers all along that have really helped folks engage in appropriate treatment for their specific needs.
And, speaking about the staffing obviously has been an issue that we've heard about in the psychiatric field for a little while here. And I think, since post-COVID, there's been extensive call times or wait times, I think, to see providers. How is it with that whole staff, with it being staffed? Have you found that, people are staying? Have you found that you're not having an issue filling those shortages?
Yeah, certainly happy to speak about that a little bit. So we certainly got to a place where we had enough staff to open. I think, just credit to the team and the recruitment that started so much longer before we've opened, and really focusing on, the safe staffing. And we've gotten to a much better place in a lot of areas, but we felt like it was always safe. We wouldn't have opened otherwise. I think one of the differences with our facility to many facilities is we were really able to create our structure to match what's needed. So when a patient arrives, immediately the nurse and provider are notified. So there isn't always that significant gap from when patient arrives to when they're seen, as there is in a number of places. So comparing, our numbers to that of a medical ED, everyone's for us is in crisis. So getting to that safe point with the patient is really important. But overall, I think staffing has been fairly stable. There's always, room for improvement.
Sure.
Or something's changing. But overall, I think they've done a really, really amazing job and providing quality care and, safe staffing.
Right. And you hit the headline right away that you all had enough staff to open a facility like this, which is unbelievable. And to have that many patients really pass through your doors. Have you seen a difference, or have you communicated with, others in the Riverside Health Program about maybe has this taken the weight off yet of the emergency department? Is it still too new to sort of see those results yet?
Sure. So I think that there has been benefits already to our medical emergency departments and really getting patients over much quicker than we were able to previously when we didn't have some of the resources that we have in our emergency department now. So there has been a lot of gratitude from our medical emergency departments and helping folks arrive at our facility and into our, inpatient units or to outpatient services. So I think that they are starting to see a bit of a decompression there. The truth is everyone's incredibly busy too. So it's almost like, okay, this patient's got away, but suddenly there's a new patient
Right.
with some other sort of need for intervention in the medical EDs. So I think overall everyone's doing a great job and we're starting to absolutely see the benefits. And I think part of that as well is folks coming directly here as opposed to the medical EDs.
Right. And I was going to ask too, our EMS, would they, if they were called, an ambulance maybe for care in this situation, can they take patients to your doors, or is that still something that they go to an emergency department and figure out that process?
Sure. So we are working through some of the final details on that, but I think it's a great opportunity to shout out the CARES team locally and their connection with us and having folks come here that may be medically okay and just need that psychiatric component and certainly our law enforcement locally has a number of interventions with folks that might be primary psychiatric or recovery related, and they do bring folks directly here as well. So working on some things still, but also some in motion already.
That's great. And I know throughout the area, obviously, there are so many resources, maybe when you're not at that emergency level as well, community service boards, different organizations. I know that at least in Virginia Beach, when you call 911, you can ask for somebody to offer de-escalation, techniques to be involved. So I know that there are so many things that we're trying to do in this community. So it's great, to hear about those partnerships and sort of trying to make some of these maybe more advancements, sort of work together, I guess.
Yeah, absolutely. So I think the whole 988 initiative has been amazing and has helped folks really with the unique needs that these patients have and an intervention there as well. The Community Services Board offer a number of different resources and are always available at any time if folks have a need. I think it's important to mention too, a lot of primary care providers, if folks are dealing, with a low level of anxiety or depression, oftentimes folks turn to their primary care providers who have a number of different resources that they might be able to offer as well. And we are lucky to, in the Hampton Roads community, to have a number of individual therapy practices and things like that, family therapists that can really help with some additional needs that might not be as urgent as well.
And before we end, I don't want to take up too much more of your time, but I wanted to say that this center has more than just the psychiatric emergency department. Can you just tell me a little bit about the other services that you all offer there?
Yeah, absolutely. And again, kind of going back to where I started, our goal was to have one roof where we offered all different levels of care for folks. So really, when we look at mental health and recovery treatment, you find the most success by having the continuum of care. If somebody starts off in the emergency department and requires an inpatient psychiatric hospitalization, leaving that intense level of care just to follow up in 30 days doesn't always lead to success, I'm sorry. So that was something really important to us. So what we have here is our ED, of course. We offer inpatient acute services for adolescents aged 12 up until 18, and then adult services for 18 and over. On the outpatient side, we have two different PHP programs, and that stands for Partial Hospitalization Program. It's about 6 hours a day. It really embraces the name. It's really working to stabilize in the community. You spend 6 hours a day at the hospital, learn some real skills that are important, and then you would step down to an IOP, which is intensive outpatient program, and that's 3 hours a day, 4 hours a week. And we are working on the final stages of our general mental health outpatient clinic to help with provider visits, individual therapy, and things like that. And I will also mention that our PHPs and IOPs have two separate tracks, one specific to mental health and the other specific to recovery or substance use disorders. So great team to be able to provide those services there as well.
And I just want to highlight for anyone watching how important that area of care is, because we've heard from so many parents say, we took them to the emergency department or we, cooled off the initial crisis, but then trying to manage hospital back home, that's where another piece comes in that they don't know how to navigate. So those programs being part of the clinic, I feel like is just absolutely crucial to get them off of this crisis and sort of navigate back to real life.
Absolutely. So our dream would be one day, right now our outpatient services are for adults specifically. Our dream would be able to, continue to grow and meet everyone's needs everywhere. But one thing that we do ensure we do, whether you're inpatient, outpatient, or in the ED, is really to engage with the services that are most pertinent to that individual. So it might be an in-home therapist for an adolescent, or community services board, somebody that has the specific services for that individual. That's what's going to keep folks out of crisis moving forward.
Well, Stacy, thank you so much. I don't know if there's anything else, just on from your hospital perspective that you all are working on. I feel like you've given, great things in this conversation of things that you're hoping to continue with or grow down the line. But is there anything else that you're looking to highlight?
Well, I think that over the last several years, mental health has just been spoken about more and more. More folks have, experienced individual crises and whatever that means to that person. But I think what we can all do is really get comfortable talking about mental health. I've said 1,000 times in my career, let's get as comfortable talking about mental health and recovery as we are about our physical health. If we aren't taking care of ourselves from that perspective, from a mental health perspective, our physical health is likely to be impacted. So, I think if we can all be part of the change and destigmatization and get comfortable talking about it, I think that's going to really help our community and just nationally. So thank you for highlighting this and really having folks understand the care that we provide here. I think oftentimes there's perspectives of what happened in psychiatric facilities, of movies or, something that's seen on TV. But the truth is our goal is really to create that calm and help people the best we can.
Absolutely. And again, if you're joining us a little later, the video that you've been watching, that is a video of the actual facility. So just to give you an idea, again, to Stacy's point, how different it is than a traditional emergency department, just to give you that look. But Stacy, thank you so much for joining us this afternoon. It's been great to hear about this and the success the program's had, since November. So I guess we'll do another check as things develop and hopefully you reach more patients this quarter of the year.
Absolutely. Thank you so much.
Thank you.